Good morning.
Good
Good
morning.
morning, sir.
Good morning, sir.
Okay.
Good morning, Dr. ROJoson.
Yeah. Can I ask everybody to unmute themselves first?
Okay po.
Okay.
Morning po.
Morning, sir.
Hi. Good morning. Okay.
Morning.
I'm not aware of how many students there are at the moment. No. Can somebody tell me, because Dr. Gundran has not given me the information. How many students are you enrolled in this class?
Ganyan po.
9?
9.
Did I hear 9? Okay.
9 are currently in the meeting, sir, but enrolled in a class.
May isa pa yata. Yeah, so
Around 10?
around that.
Okay, around 10. How many?
Yes, sir.
Okay, I just want to know, because I have to adjust my lecture, because in the past we have a lot of international students. No? Are there international students right now? None? I see all except for Yi. Everybody has a Filipino family name.
But I'm sir. I'm just Chinese.
Philippines, in the Philippines.
Yes, sir. I'm friends
Okay.
with Ray, sir.
Ah,
I'm
okay.
friends with Ray.
You're friend with my son.
Yes,
Okay.
sir.
Okay. So how many? Okay, so all local, huh? Local. Can I assume that all local?
Yes, sir.
Yes,
Okay.
sir.
Okay. Okay. So this is the first class that we have for HA202. Is that correct? Okay. Is that correct?
Yes po.
Yes, sir.
Yes, sir.
First class. Okay. So HA202 is on management of the different departments, right? The different hierarchy, the different departments, services in the hospital. Okay. So I was asked by Dr. Gunran to give the first salvo. No, this is actually a lecture that will lay down the groundworks for, it's sort of a template, no, in the management of all the departments, okay, sections, divisions, okay, in the hospital, okay. So before I start, okay, Dr. Gunran is not around to introduce me to you, okay. So let me do the introduction first. I am a graduate of the College of Public Health, Master in Hospital Administration in 1991. Okay, so and then since then I've been giving a lecture probably since 1993, 1994 up to now. Now, giving a lecture particularly on the different departments. Now, I was assigned actually 4 lectures every year. Now, one is this one, the systems thinking, which is an overview on the management of the different hospital departments. Then I will be giving a lecture on the Department of Surgery as a prototype of all the clinical departments. No? Okay. Why Department of Surgery? Because I am a surgeon by profession. Okay. Okay. And then I'm going also to give a lecture on emergency medicine. Okay. And then lastly, the last lecture that will be assigned to me will be hospital quality accreditation. No? Okay. So these are the 4 lectures that I'm going to give to you this semester. Okay. So in terms of experience, okay, so it's either you look at my CV, or let me just say I've been a hospital manager from 1989 up to 2018, when I completely retired from hospital administration. So I've been a assistant medical director in Manila Doctors Hospital. I've been chairman of the Department of Surgery of Hospital Manila. Hospital Maynila, and then Division Chief of the Section of the Division of Head and Neck, Breast Thyroid Surgery in PGH. Okay. And then I do some consultancy in the past. No? Okay. Strategic planning, quality hospital management. No? Okay. Any question? Okay. So can I start?
Yes, sir.
Okay. So okay, let me have a slideshow. Share. Okay. Can you see my slides?
Yes, sir.
Yes, sir.
Yes, sir.
So you can interrupt me anytime if you have any question. No? Okay. So good day. Again, I'm Dr. ROJoson. I was asked to give a lecture with this title, Systems Thinking in Healthcare Facilities for HA202, with a time limit of 30 to 45 minutes. I hope I can finish this on time. And with the following prescribed learning outcomes or objectives. Number one, understand how to run and manage a hospital effectively and efficiently by systematically using the systems approach or perspective and systems thinking. Understand the importance of alignment and integration in managing a hospital and its departments. Describe a hospital department design and development framework, how to use and apply it, and be familiar with the basic requirements in it. And number four, discuss the common challenges encountered in the governance of departments together with their suggested strategic solutions. With these prescriptions given to me by Dr. Gunran, I shall delimit my presentation on health facilities to hospitals, because health facilities can mean a lot of things. Okay, I will just be focusing to hospitals with, okay, with some delimitation to the department rather on the whole hospital. Okay, I'll go by each department. Thus, I would like to change my title then to System Thinking in Hospitals with focus on departments. Okay, so this is so that I will be aligned with the learning outcomes or objectives I just spelled out a little earlier. Okay, so let's start with the structure and basic functioning of hospitals. All hospitals are made up of many different departments and services. We look at the hospitals as a system that is a set of interrelated but separate parts working towards a common purpose. As hospital managers, we must know how to manage the hospital effectively and efficiently by making sure that all the various different departments and services are aligned and integrated in their governance and functioning. Systems perspective, systems approach, and systems thinking are various terms that you will encounter in the management discipline manuals, and all are geared towards ensuring alignment, coordination, collaboration, and integration of the functioning of the interrelated parts of a system. Suffice it to say that systems perspective or approach to management views the organization or the hospital and also the department of the hospital as a unified, purposeful systems composed of interrelated parts. This perspective or approach makes the manager sees the entire organization as a whole and as a part of a larger external environment. System thinking, on the other hand, is a holistic approach to analysis that focuses on the way that a system's constituent parts interrelate and how systems work over time and within the context of a larger system. Put it in another way, systems thinking is basically a way of helping a manager to view the systems from a broad perspective that includes seeing the overall structures, patterns, and cycles in systems rather than seeing only specific events in the system. This broad view can help the manager to quickly identify the real causes of the issues in the organizations and know just where to work and address them. Systems perspective, approach, and thinking are management disciplines that are concerned with an understanding of a system by examining the linkages and interactions between the components that comprise the entirety of that defined system. The bottom line of systems perspective, approach, and thinking is the recommendation for all managers to view and analyze situations in the hospital and also in the departments holistically and comprehensively, and to always look at the interaction of parts to other parts and to the whole and vice versa, with alignment and integration as key result and key performance indicators. So what is alignment? Alignment means a state of consistency among plans, processes, information, resource decisions, workforce capability and capacity, actions, results, and analysis that support key organization-wide goals. This is a definition coming from Baldrich's Healthcare Criteria for Performance Excellence. Alignment means consistency between all hospital plans and hospital goals, consistency between department plans and department goals, and most important of all, the consistency between department plans and hospital goals. It also means quality of doing things towards the same direction. Thus, to be aligned, all staff should be clear about the hospital's purpose and policies and procedures, as well as those of the department, and make decisions in accordance with them. Next is, what is integration? Integration means the harmonization of plans, processes, information, resource decisions, workforce capability and capacity, actions, results, and analysis to support the key organization-wide goals. Again, another definition from Baldrich Healthcare Criteria for Performance Excellence. Integration means harmonization between and among all parts in the hospital and departments to produce a unified outcome or goal. It is said that effective integration goes beyond alignment and is achieved when individual components of a system operate as a fully interconnected unit, such as harmonization of music by an orchestra. In effecting harmonization and integration, it is implied that coordination or synchronization and collaboration or cooperation of parts are very, very important. This slide illustrates the concepts of alignment. You can see it in number 3, and integration in number 4. The ultimate target is an integrated approach or integrated process as in number 4. Number 1 illustrates the complete absence of uniform or consistent direction of all the arrows and processes, all in different directions. This is the phase in which the organization is just reacting to problems. Okay. Number 2 picture or illustrates some amount of uniform or consistent directions of the arrows or processes. Okay, going towards a little towards strategic and operational goal. So this is an improvement of the first phase. This is the phase of early systematic approach, which should be further developed into an alignment and eventually integrated approach. As I said, the ultimate target is integration. As mentioned earlier, in effecting harmonization and integration, collaborations or synchronization and coordination, synchronization, collaboration, and cooperation of the aligned parts are very, very important. Okay. This slide shows the alignment on the left side. Then with coordination, collaboration of parts and integration is achieved. These are keys to performance excellence of hospitals. And this is what the so-called Baldrige healthcare criteria are looking for. Okay, the Baldrige healthcare criteria for performance excellence is presently the most popular international quality standards. Okay. Back to systems thinking in hospitals with focus on the departments. As I mentioned earlier in my slides, okay, earlier slides, all hospitals are made up of so many different departments and services. The number varies from one hospital to another. So the minimum number will be one imposed by the Department of Health licensing body. So I don't have to talk about international Department of Health anymore. They call it Ministry of Health. Okay. But basically they have the same system as ours. Okay. So we have the level just in different terms. Okay. In the Philippines, we call it level 1. Before it used to be primary, secondary, tertiary, whatever. Now they have changed it to level 1. Okay. So this consists of a hospital with basic departments and services. Level 2 with medical specialties but without training departments, thus with more departments and services than level 1. And level 3 with medical specialties and with training departments, thus with more departments or services than level 2. Okay. Examples of hospital departments and services. So I just broadly categorize this into in such a system. I don't think you're going to see this in the textbook. Okay. So medical services departments such as the Department of Emergency Medicine, outpatient department, and inpatient department. That's one category of all the departments in the hospital. Diagnostic departments such as Department of Medicine, Radiology, and Nuclear Medicine. Treatment departments such as Operating Room Complex, OBGYN Complex, Rehabilitation Medicine Department, medical specialty departments like the OBGYN, surgery, pediatrics, etc., nursing services, and dietary department. Medical support departments such as facility management departments, housekeeping, security, billing, and cashier department. Administrative support departments such as the Quality and Patient Safety Department, Material Management Department, Human Resource Development Department, Business Development Department, Finance and Accounting Department. Other departments and services can be created on the basis of needs as deemed by the hospital administration. Thus, roughly a hospital can have a minimum of 25 departments and services, and the number can be more, up to 50 departments and services, and even more. It all depends on the vision, mission of the hospital, and it also depends on the financial capability of the hospital or the resources. This slide illustrates the importance of alignment, coordination, collaboration, integration of all departments and services to effectively and efficiently achieve the performance excellence of the hospital. Okay, so you can see in this slide, all of these are departments working together, alignment integrated, okay, working towards the performance excellence of the hospital. Let's now focus our discussion on the departments. Just as the hospital is made up of different interrelated parts in terms of departments and services to facilitate achievement of its corporate goals, each department and service is also made up of different interrelated parts to facilitate achievement of its authorized functions and services. And each department and service is also considered as a system in the hospital. The hospital can be called the super system, and the department and services within the hospitals are subsystem. Each department and service must also utilize the system's perspective, approach, and thinking in management as in the hospital. That is, understanding the system by examining the linkages and interactions between the components that comprise the entirety of that defined system, which is the department. And viewing and analyzing situations in the department holistically and comprehensively, and to always look at interactions of parts to other parts, as well as to the whole hospital, and vice versa, with alignment and integration as key result areas and key performance indicators. Not to say that there must be alignment and coordination, collaboration, and integration of each department and service with the whole hospital and with other departments and services. So it's also important to have coordination, integration with other departments. This slide illustrates the hospital and departments as a system with interrelated parts, with the hospital being the super system with various departments as subsystems and the interfacing departments as co-systems. Each department is also a system by itself with interrelated parts or processes. So when planning and doing problem solving, all managers should have a perspective and analytic thinking that look at the parts simultaneously at the whole and vice versa. The approach should be holistic and comprehensive and systematic, using the input, throughput, and output processes that consider the external as well as the internal environment. The key results areas of the system's approach and thinking should be alignment and integration of all the subsystems or parts towards achievement of a department's vision, mission, goal, and objective, and eventually the hospital vision, mission, goals, and objectives. This slide shows the essential and basic components of a department which must be present to facilitate accomplishment of its authorized functions, services, and achievement of its goals. You have leadership, authorized functions, authorized services, goals here, architectural design, okay, physical structure, DOH licensing department requirements, policies, procedures, risk management system, human resource program, equipment and material program, data document records program, business development program, budget program, IT-enabled system, and regular performance evaluation and continual improvement program. So all of these components must be present, aligned, and integrated with each other in order to achieve performance excellence for the department. And on the extreme left, you can see the need for alignment and integration with the whole hospital, as well as with other departments in the hospital. So this slide illustrates the super system, which is the hospital, the subsystem, which is a particular department, and co-system, which is an interfacing department. The arrows indicate the need for alignment and integration of all the parts of the system, the department, with the super system, the hospital, and co-system, the interfacing departments. At this point, I'd like to disclose that this department design and development framework or administrative design and development program was developed by yours truly in 2010 to facilitate learning, planning, and administration. This department design and development framework is applicable to all departments and services in the hospitals, such as emergency room, department of surgery, operating room, housekeeping departments, and others. And to fully develop this framework, there must be a manual that contains description, elements, and management systems of each of its box, or the so-called design and development blueprint. After the design and development blueprint, there must be evidence of implementation and evaluation of the results of the implementation. Okay. So I shall now discuss the hospital department design and development framework, how to use and apply it, and be familiar with the basic requirements in it. As I said, this will serve as a framework for all the other departments that you will go through, you will be studying. So on the extreme left of the framework, there are 4 boxes that refer to the hospital and interfacing department. Okay. So whatever be the department, the administrative design and development program should be aligned and integrated with the whole hospital's concept and design. Okay. Governance policies and procedures, operations policies and procedures, as well as the interfacing units or the other departments' operations, policies, and procedures. So in other words, there must be systems perspective or systems thinking. Leadership. Whatever be the department, there must be a competent head with at least the following competencies: unit technical requirements competencies on the specialty of the department, as we know that each department is identified by a specialty. Okay, so the head must have technical competency in the specialty of his department. Hospital teamship or team playership, managership, and leadership. There must be at least a job description or job descriptions, job specifications, and performance evaluation systems of all the leaders and managers. Okay. Functions. There must be a document stating the authorized functions of the unit. It must be complete and clear with general and specific functions, and it must be authorized by a higher office. Service. There must be documents stating the authorized services of the unit or the department, the services that are being offered, and the functions that are being authorized must be congruent with each other. Then the goals. It jumps to the goals. We have the throughput, then the output. The goals, there must be a document stating the ultimate goals, which must be aligned and integrated with the goals of the hospital. Remember, we're talking about the department now. So it should be aligned with integrated with the goals of the hospital. So the basic essential goals, which are quite universal, is that you must have performance excellence, client engagement, quality and safe healthcare services, because we're talking about hospital healthcare industry, okay? Cost-efficient and value-based services, maximal utilization of services. So all of these goals should eventually be contributing to the financial viability and sustainability, not only of the hospitals, but of the department, but also to the hospital. So this slide shows the basic processes of management in the department design and development framework. You have the input, the leadership, functions, and services. Then you have the outputs, the goals. Okay, in between the input and outputs are the throughputs, which I'm going to discuss now. Okay, so DOH licensing and structural requirements. Okay, so this just means compliance to DOH guidelines in the planning and design of hospital and other health facilities. There's a manual on this, but it's not really updated. No? Okay. Then the Safe Hospital Initiative, which consists of structural, non-structural, and functional indicators. Again, there is a manual on this. Building code, fire code, and local government requirements, etc. Physical structure refers to the geographical space or area in the hospital to construct the department to receive patient and physician clients requesting for services and to house the staff who will perform the functions of the department. Service requirements as dictated by the authorized functions is the first determinant of the physical structure of the department. Let me repeat. The service requirement as dictated by the authorized functions, which you have to do it first, okay, is the first determinant of physical structure of a department. The other determinants of physical structure are the following: statutory and regulatory requirements, DOH licensing and requirements, okay, building code, fire code, local government requirements, specialty requirements, particularly on the training and research, human resource program, equipment material program, data, document, and records program, budget program, risk management program, business development program, quality standards, community expectations, efficiency, caseloads, and also most important of all, the owner's wants, especially those in the private setting. So you can see the structure, in the determining the structure, there are a lot of factors to consider. The other determinants are quality standards, of course, community expectations, efficiency, caseloads, and owner's wants. Okay. So architectural design, engineering, and construction. This will be dictated by the DOH licensing and structural requirements and the physical structure requirements. And then you can innovate, do some innovations, but make sure that you have the go signal approval from the DOH. Human resource program. There must be a document showing job descriptions, job specifications, performance evaluation systems of the human resource in the department. There must be documentation of adequacy in number as well as in competency. Equipment and material program. Again, there must be a document showing adequacy of equipment and materials needed to facilitate an effective and efficient functioning of the unit or the department. In consideration, always go back to the key functions and services. In consideration of the key functions and services of the unit, also look at the statutory requirements and other objectives like business development, risk management, and IT-enabled system. The next box is data document records program. There must be a document showing adequacy of data, documents, and records needed to facilitate an effective, efficient functioning of the department in consideration of the key functions and services, statutory and regulatory requirements, other objectives like business development, risk management, and IT-enabled system. Under business development program, again, there must be a document showing the presence of a structured and comprehensive program or write-up that will develop the business of the unit to make it viable and sustainable. Budget program, a document showing a budget that projects future income and expenses of the department, and the budget is being used as a guide for day-to-day performance and financial evaluation at planned intervals, okay, yearly, monthly, okay, etc., etc. Risk management program. There must be a document showing the risk management program, which is a plan and systematic process or program to reduce and or eliminate the probability of a risk that usually results in injuries, losses, and legal suits. When you talk about risk management or risk assessment, most of the time you think of the negative effect, but you can also include risk with potential positive effect, which means, which example is improving the business, okay, improving the client engagement. IT-enabled system, there must be a document showing the use of IT, information technology, to promote efficiency in the performance of functions and accomplishment of the services, to manage information of unit, like getting, storing, protecting, processing, transmitting as necessary, and later retrieving as necessary. Also to create interconnection with other units in the hospital for timely communication, coordination, and collaboration in the accomplishment of the services of the unit, and to communicate with the patient and physician clients, both in and out of the hospital. The next box is policies, procedures, clinical practice guidelines, and clinical pathways. There must be documented policies, procedures, clinical practice guidelines, clinical pathways that serve to provide order, to promote standardization, and to facilitate communication. Policies and procedures, clinical practice guidelines, and pathways, okay, are also used to promote effectiveness and efficiency. And they are also used to provide a guide to present and future staff, among other things. They must be aligned with the policies and procedures of the hospital, and they should be reviewed and revised periodically. So let's take a look at the clinical practice guidelines. All of you probably know this, okay? So it's these are systematically developed statements built on the synthesis of evidence, which provide formal recommendations about appropriate and necessary care intended to assist practitioner and patient to make decisions about appropriate health care for specific clinical circumstances. Okay, systematically developed general statements, okay? Now, clinical pathways is an interdisciplinary plan of care involving various disciplines, nursing, doctors, okay, and others, non-healthcare professionals, okay, that outlines the optimal sequencing and timing of intervention and expected outcomes for patients with a particular diagnosis, procedure, or symptoms. Okay, let's now go to the one of the last box, probably. Okay, the regular performance evaluation and continual improvement program. So there must be a document that shows a program to appraise the extent of accomplishment of the unit or the department in its authorized functions and business development plans at planned intervals, such as quarterly, biannually, or annual. And more important of all, to determine the areas of improvement and to act on them. So let's now go to the last learning objective, which is the common challenges encountered in governance of departments together with their suggested strategic solutions. Okay. The challenges can be in at least 5 categories: man, system and methods, machine and equipment, money and resources and other resources, and trends in hospital industries, hospital healthcare, and medical science. Under the man category are the consultants, the residents, colleagues in other departments, chief of hospital and other bosses, and of course the subordinates. Okay. So the more common problems are competencies of these people, quantity, alignment and integration, collaboration, and alignment, coordination, collaboration, integration, which I think is the most difficult. Okay, and of course, personality, which is also difficult. Okay, so suggested strategies consist of leadership and management skills. Okay, managing your boss, meaning you manage his personality, adjust according to his mindset and mood. Okay, use of multi-sectoral and multi-professional committee membership. Okay, so as to engage everybody into alignment, coordination, collaboration, and integration. Under the system and method categories, the common problems are lack of systematization in doing things, lack of standardized procedure. Suggested strategies, come out with a manual, then use the DOH licensure requirements as guide. Okay, use the quality standards as guide. There are a lot of established guidelines now, standards. The PhilHealth Bench Book, Joint Commission International, Accreditation Canada International. Okay, establish policies and procedures, clinical practice guidelines, and clinical pathways which you can adapt, but you have to adjust it according to the setting, your setting in your hospital. Under the machine and equipment categories, the common problems are, okay, the lack of a management system on equipment, lack of calibration and preventive maintenance of machines and equipment. And the suggested strategies, of course, will have to come out with the policies and procedures and then make sure that they are implemented properly. Okay. And then under money and other resource categories, okay, there will always be problems in limited resources. Okay. Okay. There's no such things as you have enough resources, you have abundance of resources. Okay. So the suggested strategies are leadership. Okay. This is the most important, and innovativeness and resourcefulness in looking for the money. Okay. The last problem commonly encountered, which is, I think, very pertinent nowadays, okay, the trends in hospital industry, healthcare, and medical science, okay, because as we all know, for the past few years, even before my retirement, there are a lot of rapid changes in trends, which oftentimes are difficult to cope, okay? The suggested strategies are coming out with knowledge management system in which you constantly keep track, okay, and do continual education of all your staff, okay, on the new developments, okay, and then benchmarking with other hospitals, and then try to innovate also, because you cannot just follow all the trends. Okay. I'd like to end my lecture by flashing again the topics that I have recovered. Okay. Okay. I won't read them anymore. Okay. How to run and manage a hospital effectively and efficiently by systematically using the systems approach or perspective and systems thinking. Okay. I just recommend that you remember this slide that illustrates the hospital and departments as systems with interrelated parts, with the hospital being the super system, with various departments as subsystems, and the interfacing departments as co-systems. Each department is also a system, remember that, by itself, with interrelated parts or processes. And when planning and doing problem solving, all the managers should have a perspective and analytic thinking that look at the parts simultaneously at the whole, okay, parts then whole, or vice versa, the whole and the parts. The approach should be holistic and comprehensive and systematic, using the input, throughput, and output processes, and that consider the external and internal environment. And the key result areas of the system approach and thinking should be alignment and integration of all the subsystems or parts toward the achievement of a department's vision, mission, goals, and objectives, and eventually the achievement of the hospital's vision, mission, goals, and objectives. For the second objective, importance of alignment and integration in management of hospital in each department. Okay. So just remember this slide showing the pictorial differences between alignment and integration and steps towards a mature process approach. The ultimate target is integration. Also remember this slide that illustrates the importance of alignment, coordination, collaboration, and integration of all the departments and services to effectively and efficiently achieve the performance excellence of the hospital. Hospital Department Design and Development Framework, how to use and apply it, and be familiar with the basic requirements in it. Just remember and use this framework. As I said, it is generic, it is applicable to all departments, it is comprehensive, it facilitates learning, planning, and governance of the department. I would suggest just put in the details, the contents in each box, and compile them into an operations manual. Common challenges encountered in governance of the departments, together with their suggested strategic solutions. Just remember this starting table with 5 categories: man, systems and methods, machines and equipment, money and trends. And recall the common problems under each category and my suggested strategies. You can add more as needed based on your setting and circumstances, particularly on the strategies. I really hope we have acquired the prescribed learning outcomes through my presentation. Thank you for your kind attention. Okay.
Thank you.
Okay. Thank you. Any questions? No questions?
Wala po po.
None so far, sir.
No? None? Okay. Think of some questions that you want to ask or clarify. But before you do that, I'd like to, as you have sensed in my lecture, I keep on emphasizing the importance of collaboration, okay, cooperation, alignment, and integration. And as I said, it's the system is likened to a orchestra. Okay. So I like to while you're still thinking of some question, let me show you an orchestra. Okay, andali ha. Playing. Ano yan? Okay, tell me if you can hear it. So you can see the drummer doing his work. The others are waiting. And then the flute. The other members are still waiting for their turn.
Sir, medyo mahina po yung
Manager,
sound.
the
Di ko po
leader,
alam
the
kung ako lang
orchestrator.
po. Sorry.
Okay, another player. The one on the right side is standing by, ready to act, ready to play his role. Okay, I don't know what kind of instrument is that. Another player. Okay, another one. Okay. Others are waiting for their turn. So it shows collaboration, coordination. I'll just fast track it a little bit. Yeah. So majority of players are already playing their roles. Fast track a little bit. Okay. So, any questions? Hello? So you can unmute yourself now.
None po, sir. Clear po yung lecture nyo. Thank you po.
None also, sir.
And okay. Okay, since I'm supposed my lecture is about 10 to 12, right? Okay, since we still have time, it's only 11. Can I get to know you more better? So let me start at the picture. Paulino. Jose Antonio Paulino, are you there?
Yes, sir. Good morning po.
Can you do a self-introduction? Tell me something about yourself.
Hello, sir. I'm a pediatric ophthalmologist by subspecialty po. I graduated in UP College of. I took my bachelor's degree in public health also in 2009, and then I graduated medicine in UP College of Medicine in 2014. And then I took my residency in PGH OFTA 2015 to 2017. And then, sir, Philippine Eye Research Institute po ako as a university researcher, 2018. And 2019, sir, I went back to PGH for Pediatric Ophthalmology Fellowship. And then in 2020, I went to the Netherlands for my second Pedia Ophtha Fellowship po. Currently, sir, I'm the department chair of Pagamutan ng Dasmariñas Ophthalmology.
Okay. Why did we contact you?
Sir?
Hello.
Apo,
Hello.
apo.
What's
Yes,
your plan?
Sir,
how do you want to?
actually, sir, I'm on the managerial side as well. Even if I'm a surgeon by passion, I still think, sir, na we really lack a lot of know-how. I'm quite not happy with the way things are going, lalo na sa provincial areas, because parang tenure, sir, ang nagpapatakbo ng hospitals. It's not really by training and education. So, if we put, sir, young blood or more learned people, lalo na, sir, during this time of transitioning, I think the masses and people understand that you really need people who know what they're doing, especially in this time. And, sir, since we're transitioning to universal healthcare, I see the need to have more efficient managers because, as you said, resources are finite. So we really have to make use of our manpower, our resources, and our instruments as much as we could to improve our healthcare.
Okay, thank you. So that's nice for you to take up hospital administration. Okay, so actually the advantage of actually I graduated my 1981, my residency. I went back to a classroom style of learning, MHA. No, it's good that you're doing it online. We have to go to the classroom, no, to check, to have your attendance check, no. Medyo mahirap yon, no. Okay, so so I started thinking of enrolling because I was assigned I was the director of the Postgraduate Institute of Medicine under Marita Reyes, okay, who was offering a course of a comprehensive course for the residents. No, so you have, aside from the residency training, she wanted to incorporate some courses on management, ethics, research, etc., etc. No, okay, so to get the credentials, so because I was not a graduate of a hospital ad, so I took up hospital ad. No? At the same time, I was appointed as assistant medical director in 1989. No? So I saw the need for taking up the MHA course. Okay, so when I was initially, it was a struggle for me because I had to go back to the classroom. No? But eventually, I was able to adjust. Then I found it so useful gives you a broader perspective of everything. No? Okay. Actually, strictly speaking, the management process uh, uh, can be used in the management of patients also. It's the same. No? Okay. Anyway, thank you. Sige. I hope I can help you with your career choice, with your career plans. Okay, Joe? Jose
Thank you,
or Joe?
sir.
So next, who is it? Oh, Eljan Yi. I saw you in my picture. Eljan,
Good morning. I'm Eljon Yi. I am currently a second year ENT resident at the Philippine General Hospital po. I graduated college from Ateneo de Manila University taking health sciences with minor in development studies. I studied medicine in the UP College of Medicine and I graduated class of 2017 and I entered residency. Our department has a sponsored program that you can take a master's in UP while in residency. And it was endorsed by our department, so I can max. Since as a department we are extended in residency training, that it may be opportune for me to take masters at this time to maximize our time. And I am also very much interested in administrative work. But I don't have much of that experience because currently, as a resident, I mostly do clinical work.
second year ENT. Second
Yes,
year
sir.
ENT. Who was there was a resident before you who
Yes,
took up HA? Who?
yes, sir. Nicole. Her name is Nicole Sakayan, sir.
Okay. Who did it simultaneously, right? The residency and then MHA together.
Yes, sir. Yes, sir. We're the same, sir. It's just that idea on a normal non-pandemic situation, the residency program is put on a some sort of study leave. So you're able to you're technically delayed for a year, so you can take your MHA courses spread out through the years. And then, however, because of the pandemic, we are delayed in general as a training program. So I think I don't have to be delayed an additional year to finish my master's and to finish my residency as long as I'm able to comply with my requirements.
Okay, so you're maximizing your time on this earth. Okay, that's good. Okay, thank you, Eljan. Okay,
May I volunteer someone next, sir?
sige, sure.
I volunteer po this great dentist po, sir, Miss Jean Arevalo.
Jean. Yeah, Jean. This is I said this is the first time that I have a full Filipino students. Before I used to have a lot of foreign. Hard to get a self introduction. So
Hi,
Jean,
sir
what
po.
can
Good morning. Talaga tong si Eljan. Sir, may fun fact ako kay Eljan. Nakatrabaho na niyan si Ding Dong Dantes tsaka si Marian.
okay.
Look
So
po
where,
for
where
the McDo commercial. Model po yan si Eljan on the side.
okay. So where do you practice?
Anyway, sir, good morning po. I'm Dr. Jean Arevalo. I'm a dentist and
Okay.
an assistant professor po at the UP College of Dentistry.
Okay.
Yun po. I have background in hospital dentistry and oral surgery, restorative dentistry, implants, and clinical dental research po. I studied it in University of Washington in Seattle, scholarship from UP Manila.
Okay.
Right now po, I'm the head of the section of prosthodontics. I teach dentures, how to make dentures po.
Okay.
Tapos po, I'm also the continuing professional development program officer of the college as well as the coordinator for several courses.
Okay.
Right now it's the implant course. Tapos
Okay.
po, I have my private practice, my own clinic is in Manila, but I do go to Asian Hospital, St. Luke's, and those two pala po, as an
Oh,
associate dentist. For
okay.
this program po, I was encouraged by the dean kasi since I'm already po in parang nasa admin na po.
Yeah. So
Yun.
you just get the principles of hospital principles in hospital management, which you can use for all types. No, as I said, the principles can be applicable to medicine, to dentistry, etc., etc. No, okay. So who's your
Actually, sir,
dean?
nahihirapan nga po ako kasi when we last time for MHA, sabi ko parang lahat ng kasama ko, they're doctors, they're affiliated with talagang alam nila yung workings of the hospital. Tapos ako, wala akong alam. Yun po. Our dean right now po is Dr. Danilo Magtanong.
Okay. Cathy Estrada is still with you.
Sa NTTC po siya, MHPED.
Cathy Estrada? Estrada?
Ay, sir, yung sa OPD po, that's Gigi Estrada.
Yeah, Gigi. Yeah, Gigi.
Opo. Sa OPD po siya. For the College of Dentistry, si Dr. Danilo Magtanong. The two are separate entities po eh. Sa college
okay.
po ako, sa college po ako connected.
Si Gigi is
with OPD po.
OPD.
PGH OPD po.
Yeah, but under one department. Department of Dentistry, di ba?
Yes po.
Okay.
Pero but separate po yun from the college po.
Okay, separate. Okay.
Opo.
Thank you. Nice to meet you.
Thank you
Okay.
po, sir.
Sinong susunod? Kyrie Grant Global.
Yes, Doc. Good morning. I am Kyrie Grant Taclobaw.
Yeah.
Pharmacy prof.
Di kita makita.
I am currently working in Kalinga.
Where? Shopee?
Yeah, medyo madilim po, sorry. So,
yeah. Okay, good.
Here in Kalinga po.
Oh.
I work for a hospital here in Kalinga.
Yeah.
So I've been working in a hospital for this, and really I've been involved in the management side. That's why I'm taking up MHA. This is my third semester already. Prior to working in a hospital, I used to teach in a university in Manila, in a pharmacy school, while taking up my master's in Diliman.
Okay.
And then when I finished my master's in UP Diliman, I thought of going home, settling back here in the province. Then when the pandemic hit, I've been stuck here in the province. So yeah, I think that's about it po.
Okay. So you're a pharmacist, ano ba? Or a doctor? Pharmacist?
Yes po.
Pharmacist. Yeah.
Pharmacist.
Okay.
Pharmacy. Yes.
Working in what hospital?
City Medical Clinic po, Level 1 Hospital here in Kalinga.
Okay. I cannot remember some of the names there that I know. Si Dupali, kilala mo? Dupali, Kalinga. Okay.
The surname sounds familiar po.
Dupali, yeah. Okay.
How about Dr. Almora po? Dr. Almora.
Almora, yeah, J. Almora. The son and the father. The father is a surgeon, Almora. No? Yeah. Okay. Yeah, I know them. Okay. Thank you. I hope you will learn something from me. Okay. Sinong susunod?
Thank you po.
Mercado Ramos, Katie. Kate.
Yes, sir. Good morning.
Good morning.
I'm Dr. Catherine Mercado Ramos. I am a pediatrician. I graduated from UPPGH, Department of Pediatrics in 2013. Yes, I practiced pediatrics for 5 years in Laguna and Muntinlupa before transferring here in Iligan City. So I'm in Mindanao. Yes.
You're from the
My husband is from here, so
Oh.
I am an immigrant.
Okay.
Yes.
Iligan.
So I couldn't help but compare yung healthcare services sa pinanggalingan ko and dito. So parang I would like to see improvements. So that the people here won't have to go to bigger cities like in Cagayan de Oro or even Cebu or to Manila to get their treatments.
That's good. So, how do you change that? How do you change it with hospital ad?
Sir, talagang ano, parang walang choices kasi dito, sir. So parang they are wala
Okay.
masyadong innovations, so the technologies are not being brought here.
Okay. So with what you're saying, you want to improve the services there so that patients, people in the community will just go to your hospital rather than go to the far away hospitals, right? Okay.
Yes, sir.
Okay. Okay. So that's good. Now that's one. The other thing will be you have to change their mindset also, di ba? So sometimes for those may kaya, they also always want to go to mas magaling sa Cagayan de Oro, ganyan. So so you have to establish a reputation also of your hospital, no? That you can do it as well or even better than the other hospitals, no? Yeah, okay. Nice to see you working in Iligan. Okay. Sino pa ang susunod? Sinong susunod? Almeda?
Continual Chapter kasi encoded on a video. So, yun.
I am Sir Dr. Belmonte.
Dr. Belmonte, yeah.
Probably the oldest of the students. 6 years old now. I became a medical director of our hospital, level 1, MMG Cooperative of Camarines Sur. 3 years ago.
Okay.
So initially it was part of a requirement of the DOH to have an HA.
Okay.
So I enrolled in UP. But they changed the requirements. It's already 4. It's hindi na siya on. Bali, ano na siya?
4. MD, pwede na.
Yes, pwede na kahit ano. So right now I'm using what I learned in MHA. I'm using it in the improvement of the hospital. The hospital is now 35 beds, 20 years in operation, and I want to improve the hospital, maybe go up to 100 beds, acquire more equipments, capital.
Okay. Okay. Saan ba yung Camarines Sur? Naga? Naga?
Yes, sir, sa Naga. Malapit sa Naga.
Naga.
Between Legazpi City and Naga City.
I don't know.
Namin.
Dr. Nolly is Nolly Bayan ba? Nolly. Dr. Nolly, Dr. Bayan. Sarmiento, Dr. Sarmiento
Yes,
is from
sir.
Robert.
Robert. Yes.
Yeah, okay. Okay, Robert Sarmiento is also a graduate of MHA UP.
Yes, sir. I know.
Okay, so nice meeting you. Okay, so that with this introduction, at least I get to know you better, and then I can adjust my lecture, my 3 other lectures, in the future. Sino pa? Almeda, is it?
Hi, sir. Good morning. I'm Therese Almeda. I graduated from pediatric residency in 2017 from PGH. I'm currently affiliated with Binyan Doctors Hospital. I am the executive assistant to the president, and I was also encouraged by the management to take my MHA now while I'm young and starting my practice. I think they want to train more managers for the future.
Executive assistant to the
president po of Binyan Doctors po, of the hospital.
Who is the president right now?
Dr. Roderick Ramos is an internist, sir.
Manila Doctors Hospital?
No, no, doc. Binyan po. Binyan Doctors.
Binyan. Yes. Okay. Binyan Hospital. Okay. Akala ko Manila.
Hindi po, doc. Binyan po. Laguna po.
Okay. Sige. So I know a lot of people from Binyan also. Binyan, Laguna. RJ Ramirez is there now, no? Kilala mo? Ramirez? RJ? Surgical onco?
Di po, doc. Sorry, doc. Hindi ko po siya kilala. Yeah.
Okay. Anyway, I know a lot of people that cannot remember the name. Sino pa? 1, 2, 3, 4, 5, 6. Kompleto na? 1, 2, 3. Who's the 10? 1, 2, 3, 4, 5, 6, 7. 7 lang kayo ngayon? 7? Hello?
Yes, sir. Yes, 7 lang po.
7 lang ngayon? Sige.
Opo.
Okay, any question about the topic?
None for me, sir. Very clear.
Mm-hmm.
None
Okay.
po, sir. Thank you.
Okay, so try to apply this. You won't go wrong, I promise you. No, you won't go wrong if you just use the template for all the departments that you're going to manage. No? Okay, so but I'm telling you, it's not easy. So you have to come out with a lot of manuals, and then after the manuals of policies and procedures, operations manual. Now the next thing is to implement it and make sure that there is alignment and integration among the staff. No? Okay. So before we leave, 2 things I want to. Andyan na si Charlie, wala pa. Adrian, andyan na si Charlie.
Wala po, Doc.
Okay. So I'm going to, my style for the past so many years is that after my lecture, I give a so-called, I call it OLETE. This is an online, O stands for online, L, learning, then E, evaluation, cum test exercise. Now, OLETE. Okay. Online, learning, evaluation, cum test exercises. Okay. So this is a practical, sort of a practical exercise or test now, in which I'm going to give you the link now. Okay. You just answer them. Now, this will be a reinforcement to what I have lectured today. And then make sure that you get 100% correct. Okay. Okay. You can have 2 or 3 or even 5 tries now. Okay. The bottom line there is that you must have a 100% perfect score. Okay. That will be the end point. Okay. Okay. Is that clear? Can we unmute your?
Yes.
Okay,
Yes, sir.
Yes, sir. Yes, sir.
Oh,
Sir, how do we...
I'm going to give you the link. Okay, I'll try to look for the link now. And then I put it in the chat box. No? Wala si no? Sandali ha. Everyone. I'll give you the link. Okay, can all of you try to open the link now?
Yes, sir. Na-access po.
Access. Unmute. Can you unmute all your, para alam ko kung tanggap niyo lahat?
Hindi po,
sir.
paulit-ulit. Wala.
Yes po.
Ha?
Nasaan yung link? Sa chat?
Chat box. Chat box.
Okay.
Yes, sir.
Mahaba. Ang daming tanong.
Multiple choice lang naman yan. I heard mahaba. 72 items. No? So the trick there is after one, don't be afraid of the wrong answer. And then after, if it's a, it will reveal your score naman eh. Out of 72, let's say first try you get 70, you get 70, then you repeat it again. Okay, what you can do is just note down your mistake. You'll be given the answer. No? Then try it again until you get the perfect score. Okay. Okay. So
Yes.
that's part of the requirements for passing this subject matter, the subject. No. Okay. And then the last thing that we're going to do, let's have a picture together. Okay. Can we? How do we do it? So everybody has gotten the link already, huh? Okay. So Belmonte, wala pa sa picture si Belmonte.
Yes, yes, sir.
Okay. One.
Makeup muna.
Makeup. So 1, 2. Wala nang gagalaw. 1, 2, 3. Okay. Okay. So you can have print screen din sa inyo, no? Okay. Okay na. So with that, goodbye. So
Bye, sir.
Goodbye po.
Thank you very much,
Thank
sir.
you.
Thank you,
you're
sir.
welcome. Okay. Okay,
Very
bye-bye.
much po.